Boy, I was standing in there and I kind of reached around the door and I threw that switch and that auger just flew right at me.
First steer out, I roped him and somehow my rope popped over my horn. It wrapped around my thumb. The steer was going one way, my horse was going the other way, and it took my thumb right along with it.
I sat down back in my chair. Yeah, he said my eyes rolled in the back of my head and I wasn't awake for anything else.
I started feeling like crampy contractions. I'm only 23 weeks. It's not possible that this is labor. Sure enough, it was labor and I was dilated to 4 centimeters.
So Avera is located in the Midwest over a 5-state region, 72,000 square miles with over 1 million people in our footprint.
And geographically, this is such a spread out area that people can't be driving 50, 100 miles for health care.
Yeah, emergency rooms are so important in rural communities because often it's about time. How quickly can you take care of the patient to provide life-saving or life-stabilizing measures until you can get the patients into the right bed or at the right facility within the system?
Emergency medicine really goes hand in hand with the mission of Avera Health. We know that the people in these communities deserve to have high-quality health care. We are there to take care of people at their worst moment. We're there to step in and guide them through whatever they may be going through.
I went outside and right after I got to the fence post, I kind of heard something in the grass, so I looked over. And before I could actually do anything to react, it bit me.
The rattlesnake situation, it was my worst fear. I just knew time was of the essence. So I got Aiden in the car, and so yeah, we went to the emergency room.
I was taking call that day. With rattlesnake bites, anti-venom is the mainstay of treatment. The most important thing is to do a good initial evaluation of the patient. He started to feel a little sick, he was getting hot. So then you start worrying like, okay, now I need to get on the phone, talk to Pierre. He's probably gonna need some more attention.
So a lot of our calls actually come through Avera's transfer center at McKinnon, and they go through our dispatch center and they'll take in some very basic information for us. From there, they get going, they have their duties where they're making sure they can safely get off the ground and they get ready to take off and they get their flight plan ready and they take off to the destination.
CareFlight is a world-class air ambulance program that we are all very fortunate to have. They are a flying intensive care unit that can take patients to the appropriate care that they need.
So then we took an ambulance to the Gettysburg Airport because it was a fixed wing plane that came for us.
He looked fairly okay, a little pale. We did a quick assessment right in the ambulance and then quickly put him inside of our aircraft. Being a mom myself, I know how scary it can be to have to put your child in an aircraft and then be taken somewhere and you not know about them. So I was really grateful that Carrie was able to ride with us and sit next to her and let her know that Aiden was going to be okay.
We like to say that we're going to deliver the same care to any patient that comes into any of our Avera emergency departments across the footprint. And we understand that there's not a neurosurgeon in Britton, South Dakota, and there's not a cardiologist in De Smet, South Dakota.
But what is great about the Avera system is that when a patient or their family walk into one of our rural emergency departments, they should feel the full support of an entire system.
We give that patient everything that we can do locally while simultaneously arranging for them to be transported to the higher level of care to get the more advanced procedure or medication or therapy or whatever it may be.
We know that outcomes and people's lives depend on getting them to a tertiary care center. If we can help decrease that out-of-hospital time or provide that level of care really they need to bridge that gap is something that is crucial for our healthcare system. The reality is we all work at Avera because I think that that's something that we care a lot about is our patients and our families. That feeling to hand them off to that trauma surgeon or that ER physician or even in the ICU and to know you made that impact is what we're all about here in healthcare. I think there's no better feeling when you're called to do this.
It is a privilege every day for myself and my team across Avera to care for patients at their most critical time.
The grit, the heart, the integrity, it is incredible how everybody pulls together to make sure that we can serve that patient.